Good morning, good afternoon, good evening, wherever you're watching the world. Welcome to the Centre for Universal Health at Chatham House in sunny London. We're delighted to have such a large audience with us today for this very important discussion before the G7 summit that's going to be held at the weekend. The Director General of the World Health Organization said this is potentially the most important G7 in the history of the entire organization. And when you think about it, he's absolutely correct. You know, the G7 has never faced a crisis like this before. Last year's G7 summit, of course, was cancelled because of the COVID pandemic. And I suspect expectations would have been fairly low anyway for an event chaired by President Trump, talking about a multilateral response to a crisis like this. But this year is very different. You know, the G7 are coming together in Cornwall in person. And what has really changed since last year is not only the magnitude of the crisis, but also that we now have technologies at our disposal to overcome the crisis. So really, there is the potential for this G7 to do something extremely significant. Now, we have an eminent panel representing experts from 4 different continents today to sort of give us their perspectives on really what they feel the G7 should be doing to end the pandemic. And we've heard that the chair, our Prime Minister, Boris Johnson, is calling to vaccinate the world by the end of 2022, which would be a tremendous undertaking. Some might argue that had we started this process earlier, we could have brought that forward a bit. But anyway, the ambition is there, but will the ambition be matched with actions? We are going to be having panelists speak for about half the time today, but we want to open it up as well for the audience to participate and very much encourage you to ask questions through the Q&A function. Don't use the chat, that's been disabled, but if you use the Q&A function, and if there's a question that you particularly like, if you can upvote it, then the more popular questions rise to the top of the list, and then we'll pose those to the panel. And if you like, we could even invite you on air to ask your question, which we would prefer that if you'll be happy to do that. I should emphasize that the event is on the record today. It's not under the famous Chatham House rules. So quite the opposite. We encourage you to tweet, write to your MPs, call up the G7 to tell them what we're discussing. And we want to publicize these discussions as much as possible. So if I can sort of quickly run through who our panelists will be today, and we have longer biographies on the website. First of all, we're going to hear from the Right Honourable Helen Clark, who you'll know is the former Prime Minister of New Zealand and the co-chair of the Independent Panel for Pandemic Preparedness. Then we're going to be hearing from Winnie Binyima, who is the Executive Director of UNAIDS and the former head of Oxfam International. Then we're going to hear from Mike Ryan, who's right in the thick of the pandemic since the outset as the Executive Director of the WHO Emergencies Programme. And then we're going to hear from the Nobel laureate, Professor Muhammad Yunus, who is co-founder and chairman of the Yunus Social Business Organization. So if I can kick off proceedings and very much put it to you, the panel, that, you know, were the G7 leaders to join us in this event, what would your messages be for what the priorities should be for the G7 to help end the pandemic? So over to you first, Helen.
Well, thanks, Rob, and greetings all fellow panelists and audience. I guess my first line would be that the G7 itself can't end the pandemic, but it can make a very powerful contribution to doing so. We're talking about a meeting of 7 of the greatest geopolitical weight countries and largest economies in the world. And to some extent, ending this pandemic is about money, and a group of large wealthy economies can make a powerful difference. But it's also about political will and leadership, and it's a real opportunity for the G7 to step up. So to be really specific, and of course I'll back for the immediate recommendations which would help end the pandemic that our panel made. We have called on high-income countries, and the G7 are 7 very powerful high-income countries, to redistribute 1 billion doses of vaccine by the beginning of September and another 1 billion by early next year. This is possible. Our calculation is that high-income countries have secured 4.3 billion doses for themselves for a total population of 1.16 billion people. So even if you have 2 doses for the 1.6 billion, you've still got 2 billion doses to redistribute. Now, the most up-to-date numbers I have for what has been redistributed through COVAX to date, actually delivered, is just under 250 million. So they're nowhere near actually meeting the challenge that we've laid down to redistribute what you don't need and what you've got on order. And this is so urgent, of course, for ending the pandemic. And we all know, none of us are safe till all of us are safe. But some people, are starting to talk about vaccinating now down to their teenage population in the West, while other countries are struggling even to get enough for frontline health workers and the most vulnerable. So no brainer, G7, please lead on vaccination. Now, secondly, as we know, that the vaccination issue is not just about the redistribution, it's about the desperate need to scale up the production. And that means that the vaccine manufacturing countries, most, if not all of which, have heavily contributed public money into the development of these vaccines, need to be banging heads of their companies and supporting getting the intellectual property and the knowledge and technology out with voluntary licensing now for scaled up production. And we're not talking about a one-off global vaccination, are we? We're probably looking at boosters, at revaccination. We have to have scaled up manufacturing. I'm a total supporter, by the way, of the TRIPS waiver. I think one should be automatic every time there's a pandemic. We shouldn't be having to debate this de novo every time. But if G7 would put its weight in behind this, that would really be so powerful because they represent major manufacturing countries. Look, my last point would be that the Access to COVID Tools Accelerator, I think, is still around $18.5 billion short for this year. The letter that Gordon Brown and I and many others have signed to G7, which is in the media this week, calls for the G7 to cough up 67% of that. That would be a fair share on ability to pay. Our panel was a bit more modest and said 60, but hey, 60 to 67% should be coming from the G7. So as I said, it's partly about money, it's about political will, it's about actually giving substance to the words that we're not safe until all of us are safe and redistributing. There's 3 concrete things there that G7 could resolve to do.
Great, thank you very much indeed, Helen. And those were very clear recommendations in the IPPR report, which I know have been taken up by many across the world. And it's sort of great to see, this unanimity of views sort of going into this process. And Winnie, I know that you've been extremely involved in these debates, sort of not least in your sort of pioneering work with the People's Vaccine Alliance. Which of those areas sort of do you see as the sort of the top priorities, or maybe you have others to add to the list?
Thank you, Rob. And thank you for inviting me to be on this panel and for organizing it. And it's on day 1 of the UN General Assembly high-level meeting on AIDS. I'm also so lucky to be speaking after the Right Honorable Helen Clark, because I'm going to emphasize, underline her messages. Let me be frank and state it as it is. The G7, the world's wealthiest and most powerful countries, are failing in their duty to provide global leadership to end the COVID-19 pandemic for everyone, everywhere. More than 1 million people have died from COVID since the G7 leaders last met back in February, when they pledged to increase the global vaccine supply. Of the 1.77, almost 1.8 billion doses of COVID vaccines given globally, 28% have gone to G7 countries. In contrast, just 0.3 of COVID vaccines have gone to low-income countries. COVID-related deaths are increasingly concentrated in low and middle-income countries. Yesterday, I got the news that my friend's brother in Uganda had died of COVID, and he had had both vaccines. So we see the new variants taking their toll in the South. The scale of this inequality is not an accident. It was predictable months ago. President Ramaphosa called it vaccine apartheid, and it is. We commend the scientific developments that led to effective vaccines, with governments, including many of the G7 countries, investing more than $100 billion in their development. We welcome the vaccine donations through COVAX, but these can only meet a small immediate need. Critically, what's happening is that the power to decide how many vaccines are made, who they get sold to, and at what price was left to companies, private companies. Let me share two examples to highlight this stark inequality. Pfizer committed months ago to give 40 million doses to COVAX, 40. But to date, they have delivered 1.25 million doses, less than 1 day's production for them. Meanwhile, at least 9 people have become new billionaires since the beginning of the pandemic, thanks to the excessive profits that pharma companies with monopolies on COVID vaccines are making. Their total wealth could vaccinate every single person in the world's poorest countries if governments committed to protecting people rather than billionaire profits. A year ago, the barrier to battling this cruel disease was the science. Today, the barrier is monopolies. The People's Vaccine Alliance calls for 3 urgent actions, the same ones that Helen Clark has listed. First, that technologies need to be openly shared with every competent manufacturer in the world. I respectfully and strongly disagree with those who argue against sharing of the vaccine know-how with developing countries. We must not fall into the trap of assuming that all global knowledge and expertise are locked up in a handful of rich countries. We succeeded in challenging these mindsets to ensure that people have access to life-saving HIV treatments. We must do it again now. The WHO COVID-19 Technology Access Pool is a mechanism to facilitate such sharing, and it's the only way to immediately ensure production of vaccines and COVID tools where they're most needed. G7 must put their weight behind the COVID Technology Access Pool. Secondly, world leaders, especially G7 and the EU, should follow President Biden's leadership and support the proposal by India and South Africa at the WTO to waive intellectual property rules, including on vaccines and treatments. The TRIPS waiver would allow removal of artificial barriers that are impeding developing nations to access the vaccines. And finally, while all this is important to scale up and secure supply of vaccines and drive vaccine prices down, these actions must go hand in hand with a clear financing plan, with burden sharing according to GDP to vaccinate the world, with G7 taking the lead and their fair share. Money money is needed. Many lives have been lost, but G7 leaders can still choose a different path, one based on public health, not private wealth, a people's vaccine, as we've called it, an effective pandemic treaty that includes the recommendations of the IPPR, co-chaired by Helen Clark. We need these crucially to end COVID-19. Thank you.
Great, thank you very much indeed, Winnie. And considerable overlap there with Helen's comments around vaccines, money, technology transfers, and manufacturing being the top priorities. Now, if I can turn to Mike Ryan in Geneva, who's been at the forefront in the battle against COVID right from the outset. You've been speaking very eloquently about inequalities as well in the response across the world. What are your other messages that you would like to deliver to the G7 leaders, Mike?
Well, first of all, to thank those leaders who have actually shown good faith and are working hard to try and make this a fairer response and to save lives all over the world. I think everyone is trying their best, but we're facing some pretty horrific and brutal realities right now, and the decisions we make in the coming weeks are going to be really, really important. First of all, I couldn't possibly follow Helen or Winnie. They're much more eloquent than I. So I second their points. Just maybe some precision on the timing. Donating vaccine now is great. Delivering vaccine late is bad. We need donations and delivery now. The gap is now. And it's really important that the commitments that are made, and we hope they are made, really front load that donation process, because people are dying right now for the need of that vaccine. We've specifically asked the June to September period is crucial, and we would really hope that we'd be seeing in excess of 100 million doses in that June-July period, and echoing what Helen said, that 1 billion by the end of the year. But I do think it can't be 1 billion promised and then end of year, beginning of next year, it starts to trickle in. We'll have completely lost it by then. So I think that's an important issue. And the 1 billion doses is really about getting to that coverage figure that gives us protection of the most vulnerable, of our frontline health workers. I mean, there are health workers today going into COVID wards, intensive care units, intubating patients who are not vaccinated against SARS-CoV-2. We just need to think about that. We are literally asking health workers to risk their lives when there is vaccine to vaccinate them. And that is one of the greatest inequities that you can have in medicine or science, and equally for those vulnerable people in those communities. The second thing I would say is that it's not just about the vaccine. I mean, we really do. I mean, vaccines are the thing that we need. They're a pathway out of this pandemic. But the way into this pandemic was marked by a lot of missteps in terms of control measures and surveillance and contact tracing and the implementation of public health and social measures in ensuring we had resilient health systems. The point of impact of the pandemic is shifting day by day. It was India, then Nepal, then South America, Southern Cone. Now it's back So the point of impact and pressure on health systems is shifting with the incidence of the disease. And the incidence of the disease has been driven by human behavior or the absence of government behavior to suppress that transmission. So you have to keep one hand on the virus while you get the vaccination levels up. You can't purely rely on the single punch. You've got to be able to suppress virus transmission and bring vaccines in. And you've seen that in Europe over the last couple of months, that really, even in the UK right now, how finding that sweet spot between getting your vaccination levels high enough so you can open your society safely. Well, many countries have opened their societies without the safety net of vaccination. And we've seen what happened. We've seen exactly what happened. So I think while we need to push on vaccines, we also need to recognize we just can't be a one-trick pony here. We really have to look at the comprehensive nature of our response. We've got to look at diagnostics. We've got to look at therapeutics, the supply of oxygen, the continued training and protection of our frontline workers. They're exhausted. And everyone is saying, oh, the health systems are fine now because there aren't so many patients in the hospital. Yeah, you don't have to rebuild the hospitals, but we need to rebuild our workers. They're exhausted. They've spent 18 months serving in the front line of the most brutal pandemic we've experienced in 2 generations. So we need to rebuild that workforce and support that workforce. So I would ask that we take a more holistic view. We need to really address the vaccine issue, and Helen and Winnie are right. I won't go into the reasons for that or the drivers of that, but just speaking around inequity in general. You know, the virus hasn't killed as many, all of the people that it's killed. What's killed people is inequity, lack of access to health services for years, lack of unmanaged underlying conditions. And so many things that have predisposed people to dying in this pandemic. And then when they got very sick, not having access to oxygen, not having access to a trained health worker. And we fundamentally come back to the inequities. I've said this in many fora. This pandemic has ripped away the bandages from some very old wounds in our society. Itself, it has damaged, but it has clearly exposed underlying vulnerabilities, underlying frailties, underlying inequities. They can't be dealt with this weekend at the G7 leaders meeting. They will need to be dealt with over the long run. What we can deal with this weekend is the shocking lack of access to vaccines all around the world. That's a decision we can make. That's a promise we can make. But remember, I've worked in health emergencies and frontline emergencies for 30 years. In humanitarian intervention, in emergency intervention, in rescue missions, never ever promise what you will not deliver. Mm-hmm. Do not create hope without delivery. It is really important that the promises that are made this week are kept and are kept on time. Thank you.
Fantastic. Very, very important message, I think, for G7 leaders who do have a tendency to overcommit and then underdeliver, and you know, that will be absolutely inexcusable and very powerful as well. What you're saying about people really dying of inequities, and you know, this completely justifies WHO's big push on universal health coverage, which is of course about everyone on the planet getting the health services they need with financial protection. So there's almost an example of how we're failing on the UHC agenda. Professor Yunus, you know, speaking to us from Bangladesh, a country right in the thick of the wave at the moment that's sort of coming
Absolutely.
through, and also I'm conscious that lacking vaccines. What are your messages, for, you know, really representing the people of Bangladesh about what the G7 leaders should do this weekend?
Well, it's a very frustrating thing to come back to G7 to talk about it again. We have been talking about it for a year. Helen Clark is here, Winnie is here. They have been raising their voice every day with the Vaccine Alliance and People's Vaccine Movement. So this message is very loud and clear. That's not a problem. But problem is anybody listening? So if they are willing to listen, the message is all there. It's been repeated here very clearly and loudly. We were coming from those golden days of global village. The whole world is a village. When the pandemic came, we turned into islands, and little islands everywhere. And today we're talking about G7. We didn't see G7 as long when pandemic came. We saw 7 islands distributed all around. So whether first thing is G7 getting back into one island now. If that's on one island, we can talk to the rest of the islands which are still floating around. They are not together yet. So whether we'll deal with the one island, 7 nation island, single island, the 7 villages getting 7 islands getting together, making one island, and the rest of the world, will they become one island? Is there any chance that they can get together? Because they're all floating around yet, it's not there. So this is a core question. Are we talking to someone who has a global view, or is still looking from our privileged island to the rest of the world? Is this the kind of relationship that we are having? That has to be made very clear, because everything doesn't depend on one island. So we have to make sure what we want to do, how we want to proceed, what is the solution to all this that we are saying. So if G7 is sure, want to do something concrete after they have made into one island back again out of the village concept disappeared. So at least have a 7 nation island, to come with a very bold, outrageous decision. That's what is needed. Can they do that? It's not a just wishy-washy decision. Yes, of course, we'll give you. Of course, this will be done. Of course, that will be happening. Vaccines will be coming. Now we need a global, it's already too late. We need a global plan. There is no global plan. We are always talking about so many millions, billions of vaccines. Who gets what? Where it is produced? And what is the supply line? These are concrete things. We should have worked out right away. We don't need to come back after 1 year and several months to talk about where the production will take place, how it will be taking place, where all these suggestions coming back and forth again and again, still we're wondering whether trip waiver will be accepted or not, because that's the key. If you can produce it in a distributed way, only then all those vaccines will be materialized. COVAX is nothing. COVAX is a simple little thing. The real production and real supply line, real distribution arrangement has to be part of a global plan. Everybody will see, where is my country, where is my village, where is my district, when is it coming, so that everybody knows where it is. At least a plan. We'll say, this is the plan, we'll try the best to make it happen, but some of the things may not happen. We understand that. People are very good at understanding these political talks, but they need a piece of paper where we can hold on to, rather than making some big statement that we are solving the problem. And I like the idea that 1 billion will be produced this year and will be distributed, another billion will be coming next year. That's a good number. So we have to, and at the end, Helen Clark said that the vaccine issue will be over by the end of the next year. We will produce enough to vaccinate everybody in the planet. That's a good plan. But now we go into the details. How do you make those details work it out? And we have to see everybody's name on it, everybody's number on it, where it is produced, because it has to be produced all over the world. It's not produced in one corner of the Europe or someplace else. That's not going to happen. These are all just to make a press statement, nothing else. It has no meaning to the people of the world. So we need to know where there's a production capacity all over the world. Now, take the case of Bangladesh. Bangladesh was assured right from the beginning, it will be supplied from India, from the Serum Institute. We made advance payment for that. And they made the first delivery of it. And then suddenly it stopped because India decided not to export anymore. And Bangladesh had only one source, that was India. So Bangladesh suddenly felt that there is no vaccine for Bangladesh and there is no new source. They're desperately looking for it. They went to Russia, they went to China to find some, at least to make it beginning. So why should people be desperate to do those kind of things when we know for sure it is coming? What I would say, the message I should give to G7, you are 1 year and several months too late. So you better cover that part. And it's not just simply making a statement, you have the concrete results to put into the table so that we know what it is. And this patent right is a major issue. We have to resolve it. And I'm very happy that Biden took the leadership on it. And this trip waiver is a good way to start this whole process. And we should not be quivering around again, dictating out how, and again, another year goes. This is not the time to do this. It's an emergency situation. It's emergency about people's life. So this is one part, be courageous and bold, outrageous, bold decisions, and make it a plan, universal production plan, universal distribution plan. Every number of the countries and the districts and the provinces, wherever it's going, so that we know where is the production facilities happening. So that all the single production facility in the world should be utilized. It's a war situation. So you can't just go on saying, okay, this is not good for us. We have to use every single facility is available wherever in the world. So, and make a list of all of them and classify them, which goes first, which goes second, which needs improvement, and so on and so forth. So that the war situation has to be addressed in a war exercises like that. So this is something, and this is only one part of the whole problem of vaccine and so on. Vaccine is about vaccinating people against the virus. But what about the economic life of people? People lost all their income, and that's an issue completely forgotten. The massive number of people have lost livelihood. It's a kind of hanging around. And what is there? Vaccine can keep them alive by giving them protection, but then economy comes and kills them. So it has to be both ways, not just vaccine. We are talking about vaccine because it's so visible. You can see it, you can distribute it, you can handle it, you can load it. But what about the economic situation of the people who lost their income, lost their livelihood? So these are the two issues, and it's very urgent. And I again reiterate that 1 year too late. You have to cover that up.
Brilliant. Thank you very much. And I think excellent that you're emphasizing this whole of humanity approach rather than approaching this as lots of little villages. And I think as well that the point you made about, you know, the message is clear, you know, that there's an amazing consensus, I think, you know, sort of looking at the WHO, WTO, the World Bank, the IMF, are all saying the same things. I mean, I've never seen anything quite like it.
Absolutely, very clear.
Global health has often been sort of quite fractured and you know, not agreeing on things, but I have never seen such a united voice, you know, looking at these issues. Very much encourage the audience to be teeing up your questions. We've already got 17 in, which is excellent. And please vote for your most popular ones. We're just going to have one more contribution now from the former UK Prime Minister, Gordon Brown. And that's going to be about 5 minutes or so. And then we'll go straight into the Q&A. So it's a really wonderful piece. And we'll make sure that if the least we can do is to put the link in the chat for people to see his message. I should say, just to paraphrase it, he very much sort of supporting all your arguments and you know, thanking you for your individual efforts, and him very much repeating these messages around, you know, what it's about is sharing vaccines now, not waiting till later, and the financing elements, and you know, that this should be done fairly with the G7 making their fair share, about 2/3, as Helen Clark was saying, and also the importance of technology transfers and the patents waiver to, you know, sort of make sure that vaccines are made in serious quantities right across the world, and we avoid this situation that we're in at the moment of whole continents not accessing any vaccines. But we'll persevere. We'll see if we can get Gordon Brown back right at the end. But if I can maybe go into the Q&A session now, and I say that we have some fantastic questions coming up. If we could maybe start with Nick Bass, who I think may have a question for us around overseas aid cuts. But Nick, if you'd like to sort of come on and ask your question, that would be fantastic.
Thank you very much. I hope you can hear me.
Yeah, very well, thank you.
Just to read it out, really. While Boris Johnson calls for the G7 leadership to vaccinate the world, the UK government itself has just recently reduced its overseas aid contribution, and as far as I know, is the only G7 country to have done so. And as we speak this afternoon, they are having this challenged in Parliament. The question is really, how can rich countries persuade their own electorates of the importance of global health issues to their own populations, as well as to the populations of poorer countries? And I'm not just talking about COVID, but also other infectious diseases and non-communicable diseases. Thank you.
Right, so I'm not sure who would like to sort of take that. Winnie, I'm immediately thinking of your sort of self, you know, sort of given the situation with financing at UNAIDS, you know, what's your thoughts about the matchup of what the UK has been saying and what it's been doing vis-a-vis aid financing recently?
The financing situation is yet another example of the huge inequities that are driving this pandemic. Low-income countries were already cutting their health budgets in order to meet mounting debt. They were already reducing the health budgets. Now they are faced with a health emergency and have no fiscal space to keep their health systems working. Meanwhile, the rich countries are able to stimulate their economies with trillions of dollars to get jobs back and to kickstart their economies, as well as fight the COVID pandemic. There's a clear need for the low-income countries, middle-income countries to be enabled to cope financially. What we are seeing is just a drop in the ocean in terms of what G7 countries are putting down. We see that in terms of increasing the fiscal space, special drawing rights have been issued by the IMF, but they are going more to the rich countries and less to the low-income countries. We've called for these special drawing rights to be transferred to the low-income countries of Africa and the middle-income countries. Then the aid, which should be maintained, it is sad to see that aid has been cut by the UK, the government that has been leading in terms of fighting poverty around the world, now being the one that is reducing aid at a time of great need. This is very unfortunate. And we've called on the British government to review this decision and maintain this amount of aid. This is the time we need to put down resources to get the whole world to fight both the COVID pandemic, the HIV pandemic, and other diseases.
Great, thank you. Helen, did you have any sort of thoughts on this sort of situation? It's been a very hot topic here in the UK this week, you know, with Parliament potentially debating it, then not debating it, that this sort of mismatch between what the government's been doing and what it said is what it intends to do.
Yeah, no, look, I think that there couldn't be a worse time really for cutting the overseas development assistance budget in the middle of a pandemic when, as we're spelling out, there are huge financing needs to get vaccination out and to fund, as Mike reminded us, the vital diagnostics, therapeutics, PPE, and so on for countries which need global solidarity to be able to do that. And then going forward, there's going to be a need for ongoing financing. I mean, our panel has spoken strongly about WHO's needs. You know, WHO has been left systematically underfunded by member states, and countries are going to have to step up. And again, G7 will be a very, very powerful part of that, because any global formula based on ability to pay will see G7 paying somewhere between 60% and 2/3 of any stepped up budget for WHO. We've also recommended that there be a pandemic financing facility established, which on an ongoing basis would support low and low middle income countries to be prepared and to build the capacity, skills, stocks of supplies, systems for that, and then for surge financing in the event of a pandemic. So you can't do all these things on declining aid budgets. And I think surely the appeal to the British public and to other publics of the high income countries is your lives are going to be changed irreparably if we can't get on top of this pandemic everywhere. You know, forget about your trip of a lifetime to the game parks of Africa. If you've let the disease rage there and it's unsafe to go, forget about having the trade and prosperity that comes with it. If you've created a two-tier world with a suboptimal vaccination response. We were seeing, but before the pandemic, as extreme poverty eroded, we started to see a little bit more convergence, but we're now back on the two tracks again. This is not a world designed for peace and harmony. So really, I think it's time for that moral and ethical leadership to come from the G7 to say we're all in this together. And if one of us is down, we're all down here. Let's think globally again.
Great, thank you very much. Now we've had some questions, looking at the new composition of the G7 and specifically the change in leadership in the United States. Obviously, things have changed dramatically since last November with the election of President Biden. So the question here from Liz Carty is that how can we get the Biden administration to take leadership in global vaccination efforts? Do we have huge expectations that the US is going to show tremendous leadership in this area? So Mike, I don't know if you want to sort of kick off on that, your thoughts on the opportunities for the US taking a leadership role.
Well, clearly the US has already done that. I mean, a lot of the innovation around vaccine development happened in the US. And it's great to see, I mean, over the recent days, we've seen, recent weeks, I think we've seen the big ship turning in the US. And sometimes it takes a while to turn a big ship, but once you get it moving in the right direction, it has tremendous momentum. And I hope that's what we're going to see now, is the momentum of the big countries. And again, I would, the UK is being criticized, but I would commend the UK on the international front over the last number of months, has really held the line on a lot of key principled issues and has been a driver of many of these discussions in its presidency of the G7. And the fact that this is on the G7 agenda, it's so central. Not only that, surveillance, health equity, so many other issues. But we need, I think, what the Prof said, what we need is the G7 bringing together their political, their financial muscle, their science muscle, and showing what does it mean to be a leader in the world.
Mm-hmm.
You know, what's G7 is? It's about leadership. It's saying they're the richest, most powerful countries in the world. Well, that's not just a badge of honor you wear around the ring. With that comes responsibility. With that comes a natural leadership role. And that comes with accountability. There's no written rules, but that's what we all look to the G7 for, to use that power and to use those finances and to use those influence for the good of humanity. Why else have the G7? Is it just a club so that 7 get more powerful? Or is it principally to come together and ensure we find solutions for the world by bringing the 7 most powerful nations together to discuss such important issues? And so for me, and I think that goes back to the previous question. We live in a very fragile planet right now, within a fragile biosphere that's under tremendous pressure. We see it's climate stress is driving conflict, it's driving migration. We see agriculturalists and pastoralists in conflict in the Sahel. We're seeing geopolitical conflict over water. We're seeing this fragility in the ecosystem now impacting us with the global pandemic. The problems we face globally are existential. Unfortunately, our politics is populist and nationalistic. We've got a disconnect between the threats we face as a global society and the way in which we're politicking and driving and managing politics on this planet, which is all about isolationism, islandism, Professor, and nationalism and populism. And that's not ideologic, left or right. They're on all sides of that equation. And I think we've got some serious threats in health justice, in social justice, in social equity, and in our planetary health that have to be addressed and can only be addressed at a global level with all stakeholders involved. This is a test. This is a test of our capacity to face a global threat together. And it's a test of the G7 and the UK's and the US's presumption of leadership.
Thank you. Yes, very good point. You know, what is the point to the G7 if it's not for tackling crises like this? Professor Yunus, do you have any thoughts on this? You know, the need to be more united.
Right. Yeah. Well, the one point that I would want to congratulate Biden for his leadership, particularly on the vaccine issue. We were almost frustrated that it's all forgotten. Nothing is happening. He gave a big boost by coming upright that he supports that. I hope he will give the leadership in G7 to make it happen, because that's a key to the whole solution to the problem. Unless you open the door with the key, this problem will just talk. It will not go very far. This is one I want to see the leadership. About the aid budget that you talked a little bit back, I was tempted to say that yes, what I was mentioning, one is the vaccine issue, another is the economic issue. So this touches on the economic issue, on the vaccine, on the aid budget that reduced by the UK government. That this year, now this is the time you have to enhance that budget so that people are suffering, how to help them to get over on this. And particularly, I would mention that the G7 took a leadership on the tax haven issues, to put the new taxes on the tax havens, which this brings a big revenue. So why don't they declare that this revenue, that new revenue that is coming, it will go to the vaccine issue and also with the economic issues that people are suffering. This is not something that we want to use right away. We have to use it. For this year, we will produce this excess revenue that is coming in from this, we'll use it for this purpose. So I would say this is one source, that the new tax, and this was a very good decision that the G7 has taken. Next one, I would say this is the time to reduce the military budget. It's there already. So why don't you just for the year, you reduce the military budget so that you can finance those also? Another crisis. This is a crisis of security crisis. The one thing you see, the guns and the bullets as a security issue. Another is that people's life is a security issue. So why don't you use that military budget, part of this military budget, on serving these purposes? So these are the 2 points I'd like to add to the discussion.
Yeah, fantastic. Thank you very much. And everyone knows the statistic that Costa Rica has got such a fantastic health system because it doesn't have an army, doesn't it? You know,
Absolutely.
it's one of these countries that has made savings to the benefit of its own people. Now, we are going to try and have another quick crack at the video from Gordon Brown, because it's so good. It'd be a shame to miss this, but we'll if you can tee it up again, Frini, and we'll see if we can make this work.
I think it's no exaggeration to say that Friday's G7 is a life and death matter. Its decisions will determine who is vaccinated and safe and who remains unvaccinated and at risk of dying. And I want to thank Chatham House and Rob Yates for organising this important pre-G7 event and for their contribution to making for a successful outcome. I want to thank in particular Helen Clark for the quality of her report with Ellen Johnson-Sirleaf, urging a transformation in our pandemic preparedness and resilience. To congratulate Winnie on her campaign to secure a temporary patent waiver, now supported by more than 100 countries, and for his continued advocacy for shared global solutions to shared global problems. I want to thank Mohammed Yunus. And let me say, Dr. Tedros and the WHO, today represented by Mike Ryan, have worked night and day without ceasing to rid the world of this disease. And the efforts of all 5 of you round this virtual table today have indeed brought us to a point in advance of where we were only a few weeks ago. A promise now made by Boris Johnson, the G7 chairman, that he and G7 leaders will guarantee that the whole world is vaccinated by the end of 2022, and as he puts it, through the promise of mass vaccination, make the eradication of COVID the single greatest feat in medical history. That rhetoric has now to be turned into reality, and we need to help the G7 do this. And I want to say today that we need to step up our pressure, for I fear that at the summit, we will fall short of delivering the worldwide herd immunity he has promised and is needed to make us safe again. I expect the summit communique will announce a huge extension of dose sharing by the richest countries, and that is to be welcomed. But all their announcements taken together will not be enough to reach the total of 11 billion doses that are needed worldwide to achieve the Johnson Pledge. To date, the vaccination campaign has immunised around 50% of American adults, 60% in the UK with their first shot, but only 1% of the vaccines have gone to sub-Saharan Africa and less than 2% have had their first shot there. And it looks as if just 1 in 500 of sub-Saharan's 1 billion people have been fully vaccinated. It's not surprising then that the Bishop of Cape Town has complained of a vaccine apartheid. The failure to mass vaccinate worldwide, even when we have a vaccine, is one of the reasons why 2.5 million people worldwide have lost their lives since the vaccine was first available, a far greater death tally than in 2020, and with lives still being lost at the rate of 80,000 a week, and African cases now rising fast. So there's an urgent need to provide not just excess doses, but extra finance for now and for the future. We need to do more than dose share, we need to burden share the financing of the whole medical effort. And I want to congratulate ACT-A, a unique international partnership formed in the early days of the pandemic, and its vaccination agency, COVAX. They provide the best vehicle for the global pre-ordering and equitable distribution of vaccines, diagnostics, and therapeutics to cover the 92 poorest countries. And this has to include testing and protective equipment that are urgently needed now as countries wait for the vaccines that could halt COVID in its tracks. But to bridge a huge financing gap, $16 billion more is needed this year and upwards of 30 billion next year. And life and death decisions can't be left to a wit round, and I hope people will donate. They and the implementation of Helen Clark's brilliant recommendations require a concrete burden sharing plan. So fortunately on the table is a Norwegian-South African proposal to share the costs. It takes into account each country's income, wealth, and the differential benefits they receive from the reopening of the world economy. Based on that formula, which is actually similar to past burden sharing for the eradication of smallpox, America would pay 27% of the cost, Europe around 22%, the UK 5%, Japan 6%, Canada 2%. The G7 attendees, who include Australia and South Korea, would underwrite 4% between them, and in total the G7 would pay 67% of the costs, with other G20 countries, including China and Russia and the oil states, asked to cover the rest. And if we were to do this and underwrite the pre-ordering of vaccine, as Britain and America did for themselves last year, we'd create the virtuous circle we need: guaranteed funding, stimulating new manufacturing capacity, in turn generating a pipeline in every continent, delivering a continuous vaccine supply. So, after a year when international cooperation failed dismally, we're at a turning point at which history may turn or it may not. We know what's wrong, we have yet to put things right. We know global problems need global solutions, and we're discovering that COVAX and other international organizations need the resources and support that are required to solve these problems. So I want all of us to step up the pressure before Friday. Let us be encouraged by what's been achieved already. 240 world leaders led by Helen and others have just issued a letter calling for the G7 to mark a turning point for cooperation. 250 civil society organizations have written to the G7 from Africa. Crack the Crisis, the British civil society umbrella organization covering 12 million members, are calling for vaccines for all as part of their demand for a healthier, safer, greener and fairer world. A letter from 100 of the UK's best respected nurses, the Queen's nurses, a statement from top medics, including vaccine inventors, have argued the medical case for urgent action. Religious leaders, including leaders of most faiths, from the Dalai Lama to all the British churches, have penned a letter urging the ethical arguments for acting now. And an opinion poll this week showed that more than 70% of people across the G7, 75% in the US, 79% of the UK, support their leaders paying their share of the cost of vaccinating the world. And there's a Navas petition you can still sign, adding to the 1.3 million people who've done so. We can make a difference. We know that no one is safe till everyone is safe. Friday must be that turning point where we start the building of that healthier, safer, greener and fairer world.
Thank you very much. Thank you to my colleagues for persevering there, and I'm so glad that we managed to show that. And obviously the Gordon Brown echoing of what a lot of the panel were saying there, and showing, you know, the extremely high approval ratings for the G7 countries to pay their fair share in vaccinating the world, 70%. And interesting, him referring to this commitment to vaccinate the entire world by 2022, calling it the Johnson Pledge. And perhaps this is something that we should be coining as a term to, you know, to hold people to account for what they've said, sort of moving forward. Now, we only have a few moments left, and I do feel, to be fair to the audience and the voting process, that if we can bring in Andrew Farron, please, who has asked the most popular question, and it's a very hot and controversial topic as well. So, Andrew, if you could ask your question, please.
Yes, good evening, good afternoon, whichever you hear me all right.
Yeah, fantastic.
Yeah, good. An inspiring statement by Gordon Brown. But meantime, while no one's safe till everybody's safe, I'm wondering whether the members of the panel might support or would support a COVID passport as being a condition for international travel until the virus is largely reduced through or with universal vaccinations. How would that be managed globally, do you think?
Thank you, Andrew. And Mike, can I bring you in on that? I'm sure you have views on this topic.
I do, and the question is a good question, but it's sort of a contradiction in terms, because if you say, let's have a vaccine passport for everyone who's vaccinated, but the determining factor for being vaccinated is your country having access to vaccine, then the likelihood you've been vaccinated is absolutely now determined by inequity and not by choice. So in that regard, it underpins, when we look at less than 1% of vaccines been in sub-Saharan Africa, then effectively to accept a recommendation like that means locking Africa in Africa for the next year, and then allowing everyone else to move around the world. Now, I understand the epidemiologic argument. I do consider myself to be an epidemiologist, and diseases do move. And clearly the risk of disease transmission will be greater in areas with lower vaccination rates. But there are other ways to suppress vaccination. So if we take, if you're a resident of Australia or New Zealand right now, you represent a vanishingly low risk to any country you visit, with or without a vaccination passport. So there are other factors that determine your risk. And the greatest determination of your risk in traveling is the place you came from and the underlying disease incidence in that place. If we reduce this to an argument on vaccine passports only, and this becomes just another issue, then it will just increase vaccine equity. Our emergency committee of the international health regulations was called together again by Dr. Tedros in the last month. And again, their determination is that certification of vaccination should not be used as a prerequisite for international travel. It is up to each sovereign country to decide on its own risk management measures. But from that perspective, no. I mean, from a pure risk management perspective, there are clear epidemiologic reasons why you might do that. But we need to be very, 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 very careful here, because to introduce a regime like that will be to create a second level of inequity that will do probably as much economic damage as the virus itself has. And we need to be very careful as we consider such measures.
Right. Thank you, Matt. Do others have thoughts on this as well? You know, so particularly maybe that, you know, representing populations who haven't got vaccines at the moment. You know, Winnie, Professor Eunice, even Helen.
Yeah, this will be just a sort of a double punishment. First of all, you don't give the vaccine because it's not available to us. And then you say that you can't travel because you don't have the vaccine. So I think that's not a fair decision to make.
Rob, 25 years ago, the world came together to find a global solution to a pandemic that was ravaging the whole world, the HIV pandemic, established a joint program, which I lead today, and put resources, with the United States putting down the biggest resources through its PEPFAR program. The Global Fund was created. Scientists were mobilized. A vaccine has not been found, but treatments, prevention tools have been found, and people now live long and healthy lives. 75% of the people with HIV are on treatment and living long and healthy lives. We made progress because a global problem found a global solution. All these things you're talking about are nationalist approaches to a global problem. Create a passport, do this, vaccinate our people, leave others behind. This is totally inadequate. It doesn't make moral sense. It doesn't make economic sense. It won't work. We must come together again and find a global solution to a global problem. Look at who works in the rich countries, who is on the building sites, who is cleaning the hospitals, who is cleaning and serving in the hotels. It is migrants. We are a global economy. People must move. So giving a passport to some people in rich countries just won't solve a global problem. It's a national solution that doesn't meet a global problem.
Great. Thanks. Helen, do you have any final thoughts on that? So I'm going to have to wrap up, I'm afraid.
I mean, just a final thought on it. I mean, the equity arguments have been very powerfully set out by Mike and Winnie and Mohammed, and they're absolutely valid. When we can achieve the global rollout, it may be that just as those of us who've traveled to countries with yellow fever have been used to carrying a WHO certificate booklet, a little yellow booklet, it could be that we can move, towards something like that. One thing that concerns me, and Mike may be able to comment on this, is the lack of mutual recognition at the moment of vaccination. A friend contacted me and said, I live in the UK, I've got parents in the US and children in Europe. He said, I can't get into one with this vaccination and another with the other. He's already had 4 doses of vaccine, and he's now jibbing at having the last 2 to be able to travel to the 3rd set of countries. I mean, this is nuts, isn't it? So we need some sort of standardization around, what is considered proper vaccination. But right now, the inequity of even going to certification is great, but maybe we can get there in time.
And I think you're absolutely right, Helen. It is nuts to think, people are having 4, potentially 6 vaccines. We in the UK are being sort of promised booster shots in September, October, at least for, the highest need groups. And, it just doesn't match up at all with, these promises about equity and leaving no one behind and the ideals of the Sustainable Development Goals. So thank you very much indeed to all of you. I was going to take another question, but I think that where you sort of finished up there, particularly you, Winnie, there saying, you know, this is a global problem requiring global solutions, you know, is very much what we're sort of focusing on here. And hopefully the G7 leaders, you know, recognizing that they are calling themselves global leaders, are going to sort of take that on board. And I think the expectations are running very high at the moment, you know, around the world for some serious global leadership, which I think, you know, we recognize has been lacking over the last year or so. Now is the time to turn that around. And so let's all hope that they are listening. We'll perhaps send our recording to the G7 leaders for them to watch in preparing for the summit. And, you know, let's hope they listen, and look forward to joining us in future events at the Chatham House. And once again, thank you so much for joining us today. Bye.
Thank you. Thank you very much. Thank you.